Hi, I'm Isabella Galichia,
And I'm Dr. Jody Galichia.
and in today's video, we're going to be talking about sudden cardiac arrest.
Sudden cardiac arrest occurs when the heart stops abruptly. So your heart's beating and it can occur just like that. Somebody can be well talking to you and then boom, the heart stops. They have a cardiac arrest, and that is associated with sudden death. So if nothing is done when the heart stops, either to restore the rhythm, if the heart is beating so fast that it doesn't pump anymore, and that's why the cardiac arrest occurred, or if the heart stopped completely. So often this is associated with a heart attack, but sometimes these events occur completely on their own and are just due to heart rhythm problems. Now, what can you do? Well, the most important thing is to shock the heart and try to get the rhythm back to normal. And what you're seeing now is in airports and casinos, various places where you go, there are devices there that can do cardioversion by shocking the heart. So this is a problem that we deal with. It's a problem where you have no time on the clock. If you don't get the heart started again in 3 minutes to 5 minutes, then you have permanent damage, and you may get to the point where you can't restore the heart to a normal rhythm and the patient just dies. But in the meantime, you can do CPR and try to keep the heart going, especially if you have no ability to shock the heart. You call 911, do CPR until someone gets there who can help you. And that's why learning CPR is very important for all of us, because it could be a loved one. It could be somebody in your family. It could just be somebody on the street, that has a cardiac arrest right in front of you. But if you know CPR, you may be able to save their life and buy time so someone can get there and shock the heart back to normal. CPR isn't going to get the rhythm back to normal, but it keeps the blood flowing to the brain and other parts of the body until help arrives.
So, if I had a loved one who has recently recovered or is in recovery from sudden cardiac arrest, what would be some of the questions that you would recommend to ask their doctor?
Oh boy. One question is, how do I prevent this? What can my loved one do? Is controlling the blood pressure enough? Are there drugs that control the heart rhythm? Sure there are. So trying to control the rhythm and trying to minimize risk factors is very important here. Plus the fact that we now have devices we can wear, monitors that will tell us if the heart is getting out of control. We have devices that not only can record the heart rhythm, but they can transmit the heart rhythm to a doctor somewhere else. There's a device called a koala device where you can wear the device and then it will transmit your EKG in 42 seconds to a doctor who can then decide what to do. Now, obviously, most of the time, it's not a cardiac arrest that would cause you to get in touch with your doctor in this fashion. But having the ability to monitor an abnormal rhythm of the heart is extremely important, because often what we see is the heart rhythm is abnormal, but it is a precursor to cardiac arrest. So understanding that is important, and then understanding that the need for CPR is great and may save someone's life.
Thanks, doctor, and thank you for watching. And be sure to visit hearthealthcommunity.com to learn more about sudden cardiac arrest.
Thank you.